We have a new update tonight on COVID-19 in Austin.
Health leaders say there are at least 500,000 people in our area still vulnerable to COVID-19. Our Sally Hernandez listened in on Austin Public Health's update to the Travis County Commissioner's Court today and has some highlights.
Yeah, we've learned Austin Public Health has fully vaccinated 251,000 people so far, but they fear that's not enough to get us to herd immunity.
So again, we've got to get vaccinated. I know there's been folks who didn't want to be first in line to get the vaccine because they weren't sure.
Dr. Mark Escott urging everyone to get a COVID-19 vaccine, saying they have enough shots. They just don't have plenty of people signing up to get one.
Even with the Johnson & Johnson concerns, vaccine is still incredibly safe. All of them are still incredibly safe. The risks of the natural disease are much higher, much more significant, much more long-lasting than the complications that we're seeing, which are very, very rare.
He says we are only 30% of the way to herd immunity.
Absolutely. We're literally in a race against time, and I know lots of other public health doctors have used that, but that is what we are facing. If we don't do it fast enough, we will see these variants continuing to emerge. The more they interact, the virus interacts, so the variants interact with vaccinated people, the more likely it is that it will, we'll see a variant emerge that's vaccine resistant.
He says it's going to take an extra push to get more people to get vaccinated, including possibly just walking in without an appointment and getting the shot, something the city says it is working on. In the newsroom, Sally Hernandez, KXAN News.
And even as more people get vaccinated, Dr. Escott is steadfast, insisting we continue normal precautions like social distancing and staying home if you think you're sick. Austin Public Health data appears to back that up. Escott says the Austin-Travis County area saw an uptick in hospitalizations related to COVID-19 on Friday and Saturday. He also pointed to an increase in hospitalizations among people in all age groups above 30. There have been 13 new infections at nursing homes in the last week. That's more than double the previous week.